learning. Okay, so again, good evening to everyone. So welcome again to our learning session in nursing pharmacology. After we've exhausted our day for the very tempting weather for us to either sleep, but I know but your neurotransmitters are really working for learning in our synchronous session. So for the nursing pharmacology concepts and principles, we always start with a prayer because I know and I truly believe that the power of prayer will really gear you towards uh, your RN after your needs. So as the prayer goes, uh, we have the Central Lino RN prayer. Let's go back. Our Almighty Creator, we praise and glorify your name. We humbly submit ourselves on your vital intention to claim the Central Lino RN. Help us attain the optimum health at all times, with perseverance in leading to our RN goals. Nurture us with your spirit to keep our open mind, to absorb and retain the lecture and skills concepts according to the nurse licensure examination framework. Let us decide to complete every examinations according to your will with prudence and integrity. We appreciate you and our existence to contribute in Centralino RN, Centralino 100% through teamwork. As we leave ourselves to you on our journey with the core objectives of the MCU College of Nursing AN. Amen. Let your spirit be upon to the hearts and minds of our Centralino students for them to still have the stamina with their situation in their learning environment, even though we are conducting it online. Let their health be balanced at their optimum level. So thank you very much, Lord, for bringing us here, for this opportunity for us to continue learning. So thank you very much. Amen. So again, good evening to everyone. It's almost evening because it is almost 6 o'clock. Okay. So I'm still in MCU. So I'm enjoying here in my office, in our office, to conduct our synchronous session. Okay, so let us continue our discussion. Our discussion, we ended up with the topic on the how absorption, the ADNE, how the absorption, distribution, metabolism, and excretion uh, is being considered as part of the pharmacokinetics. And through these processes, there are some terms that are very basic when it comes to the factors that determine the proper dosing schedule. Okay, so we have the route of administration. Okay, the route of administration, we have already discussed this in the last meeting related to the enteral and the parenteral routes. It is very important. And we also mentioned that the route of administration is directly associated also when it comes to the time of the effect and administration. So it is usually the route of administration usually is the reference that when it will start absorption. And usually when we talk about the bioavailability, so we have mentioned last time about the half-life. Okay, so the half-life is related to the half concentration of the drug, the half concentration of the drug, and the half time as it reached to the process of absorption. So that's half-life. But once it reached to the 100% effect of the drug at its peak, that is what we call bioavailability. Okay, so we have a half-life, which is the half concentration of the blood and the time. And if we are considering the full and the peak on the time and the maximum concentration, that is what we call 100% bioavailability. Okay, so that's route of administration. And when it comes to the onset of action, if you will encounter the term onset, always bear in mind the start. Just the same as onset of symptoms, the start of symptoms. When we talk about onset of action, it is when the drug that had been administered started. Okay, the interval. If we talk about the interval, it's the period. Okay, from the time that the drug had been administered until therapeutic effect begins. So when do the therapeutic effect begins? Diba, as what we have mentioned, the therapeutic effect begins when the drug reaches the plasma. So when the drug reaches the plasma, that is where the therapeutic effect begins until it considers to reach the target organ or the target tissues of the organ. So that is onset of action. So this is different from the whole period of the effect of the drug, kasi we are talking about when the drug had been administered, the interval when the time it had been administered, then it reaches to the plasma, and when the therapeutic effect begins. Pag sinabi natin therapeutic effect, that is the indicated effect, the side effect, okay, is starting already. Because once it reached the plasma, as what I've told you, that's the time that therapeutic effect starts until it reached these organs. So these are the two factors that determine proper dosing schedule. So let us proceed. So please, if you have questions, again, I'm opening the chat box for questions. And I really appreciate if you will have questions. If you have any experiences related to the topic, I will highly appreciate for those sharing, because it will also give us the idea on how you will connect with your experiences and how can we relate to the topics that we're discussing today. So, eto naman po, we have the what we call peak concentration level. Okay. If we say peak concentration level, di ba, this is the time that we have mentioned. If we're talking about the bioavailability, this is related to the 100% effect of the drug. So if we are referring to the maximum blood concentration, so that is the concentration level that is maximum, and when the drug reaches the site of action and provide therapeutic response, that is the peak concentration level. So ibig sabihin, all of the maximum and the peak level from the time until the concentration level, that is peak concentration level. Kasi if we say peak concentration level, that is when, from the term itself, concentration, yung plasma concentration, it means that the drug reaches already the highest, okay, the highest to the blood plasma. So if we're talking about both the concentration of the blood, okay, concentration of the blood plasma and the time itself, that is the one that is referring to the what we call route of administration. So if we're talking about the interval, it is yung term na until therapeutic effect begins. That's the onset. Now, what's the difference between duration of action and the what we call onset of action? So the onset of action, the term that will identify specifically the difference between the duration of action is that of yung start of therapeutic effect. So what I have mentioned, as what we have mentioned, from the time that it was administered, either oral, intravenous, topical, and at the start pa lang, at the start, that is what we call onset of action. But when we talk about yung therapeutic effect, okay, yung therapeutic effect of the drug, we are talking about the length of time that produces therapeutic effect. Ibig sabihin, yung from the start until it reaches the side effect. So if we're talking about the beginning phase of the therapeutic effect, that's onset. So that will guide us. And if we're talking about yung period from the start until it reaches yung desired effect, that's duration of action. So that is the basic difference. Okay, so far no questions. So again, I'm opening the chat box if you have questions. Next, we are talking about, yan. We're talking about bioavailability. Ayan. So the bioavailability, it refers to 100%. Okay. As what I have told you, pag sinabi nating bioavailability, once it reaches the plasma, once it reaches the blood plasma, it gives already 100% that have been absorbed in the systemic circulation. Just like as what I have mentioned, intravenous may reach immediately bioavailability compared to oral. Why? Because when you administer the intravenous drug, it is directed, or it will direct to the blood plasma, it will already reach the 100% bioavailability. So while the 100% bioavailability when the drug is being given by oral, it will still pass through, di ba? Pass through the GI or the GUT. So stomach, it will break down, then it will be absorbed by the intestinal tract, until once it absorbs with the intestinal tract, it will process pa metabolism kasi nga mag-undergo ito ng first pass metabolism. So that is eventually done by the liver. So if we have 100% of the drug absorption to the plasma, we have naman yung minention natin kanina na 50%. So if we talk about the 50%, so obviously this is the 50% that we are referring the half-life. So the drug's half-life. So that is why the essence and the importance, the significance of doing the appropriate, what you call this, the appropriate time or the definite time of the administration, then it must follow through the next time of administration. Because as what I've told you, for example, if the drug is every 8 hours, if your administration of drug is started rather 12 noon, then we expect after 8 hours, 2, 3, 4, 5, 6, 7, 8. I'm sorry. That's 1, 2, 1, 2, 3, 4, 5, 6, 7, 8 o'clock. So it's supposedly expected at 8 o'clock. Now, it means that from 12, so 1, 2, 3, 4. So at 4 o'clock, yun yung 50% half-life. Ibig sabihin, the drug plasma concentration is already 50%. Half of which is being distributed, half is still subject for distribution. So ibig sabihin is 50%. So once you have administered the drug at 8 o'clock, so yung other 50% na nag-reach ng 4 o'clock, so bababa na yon, di ba? So pag bumaba na yon, and once 8 o'clock, you will give again the other drug, then it reach again the 100%. Kaya that's why when you are giving an antibiotic or antimicrobial drug, the problem that you will not administer it at the right time. So yung percentage of yung pag-control mo for the synthesis of the growth of microorganism, instead of continuous, it will not lead to its objective to inhibit the growth of the microorganism, kasi if it will lapse yung time or it will have a gap of the time of administration, the microorganism again will start to increase yung number. So hindi siya nako-control because it's only the 50% that's going down yung effect. So dapat there is another continuation of the antibiotic therapy. So that's the purpose of why we need to know and have the mastery of the concept of the bioavailability and the drug half-life. So again, for bioavailability, once the drug reaches the plasma, the systemic circulation as well, that reach 100%. When we are talking about the time required decreasing 50% into the drug plasma concentration, that is connected with the concentration in the time, that's drugs half-life. So very important ito. You need to follow this religiously, because and seriously as well, because since we are talking about the medication as a therapeutic regimen, as a treatment regimen for our patients. So let us commit ourselves also that we are an advocate of the patient's health and welfare. So next po, so far we are on the 6 factors. So it's the factors that we have discussed. So let's see if you have the basic knowledge that already retained in your subconscious mind. So let's start with the questions for the self-assessment exercise. The nurse administers the drug intravenously, which is expected 100% absorption. So you may, again, as a rule, you may type your answer, the letter in the chat box. Is it referring to bioavailability? Is it referring to half-life? Is it referring to duration of action? Or is it referring to onset? So please post your answers in the chat box. We have already 4 responses, 6, 7, 8, 10. We are 25, so I may expect 24 responses. So again, we are talking about when the drug had been administered intravenously, the nurse expect to have 100% absorption. Because I think the one that we have discussed about this is when the drug already reached the blood plasma, then the concentration itself of 100% had been achieved. So what is the concept that is referring to? So we have 17, okay? More number, hoping for the others 18. So we still need for 6. How about for the others 19, 20, okay? 4 more, 2, okay, 3 more, 2, okay. I expect to have 24, 23. The other one, okay, we have only 23. Who's the last one? The last one, the last one. Please, I will very much happy if we will perfect it by 24. So baka probably she or he is having a problem with the connectivity. So I'll just check your responses, Your responses is okay. Okay. So majority have answered. Okay. Okay. Sige. So from our 23 responses, our correct answer is referring to what? Bioavailability. So for those who answered letter A, 100% absorption is referring to bioavailability. Again, if we are talking about the plasma, this is referring to the 50% of the drug that reached the plasma. And duration of action, okay, what's the difference again for the duration of action? Yung duration of action is the length of time, okay, the length of time wherein it considered the therapeutic effect. Yung sa onset, this is yung time wherein yung beginning, okay, yung beginning ng therapeutic effect. We are only referring to the begin, when the therapeutic effect begins. That's the onset. For the duration, it's the whole interval, the whole length of time that we are referring to the therapeutic effect of the drug. Okay, let's see. Next self-assessment question is referring to the nurse administers, mukhang alam nyo na, the nurse administered the drug on the right time and frequency. Since the drug plasma concentration reaches 50%, so let's see, is it half-life? Is it bioavailability? Is it duration of action? Or is it onset? So please post your answers in the chat box. We have already 8 responses. 8 responses. So probably this is the time that I may already call participation so that to share his or her answer. So we are 18, hoping to reach 23 again. 23 again, 19. Okay, how about for the other 4? 5. 5 responses, hoping we could still have 23. Okay, 20. 4 responses or other 2 responses. We are now 21. Hoping everyone will participate. So the other 2, we're waiting for the other 2. Okay, okay, last 2. If it reach last 1, actually we are someone was disconnected. So last 1 to reach 23. Okay, but anyway, we have 22. So I'll just call Miss Marquez. Freya, what is your answer?
Sir, C po.
Your answer is letter C. So why letter C?
Kasi po, sir, gaya po ng sabi niyo po kanina sa length of time po, yung sa duration of action po.
Okay, sige. So later on, we'll try to reveal the answer. Thank you very much for that try. Next, we have, can we ask? Yes, Miss Gonzalez, thank you for raising your hand to volunteer. What is your answer?
Letter A po.
Letter A. So why, Miss Gonzalez, letter A?
Bali yung keyword ko po is yung 50%. Sa pagkakaalam ko po sa nileson niyo po is kapag yung drug po 50% na absorb na po siya, tas yung 50% for distribution pa lang po siya sa katawan po natin. Yan po.
Okay. Thank you so much. Thank you. Next, I think I saw a raised hand also, Miss Laginlin. Can you share your answer?
Ang answer ko rin po is yung letter A po.
Yeah? Can you elaborate it more?
And yung tulad din po ni Francine yung sa 50% po. Pero sa akin din po nag-base din po ako dun sa right time and frequency. Since pag sabi po natin yung drugs half-life, ano po, para po maano natin yung significance po niya, kailangan po natin yung appropriate time po ng administration. Kailangan po nating sundan po. Pati po yung next time kung kailan po natin ibibigay yung kasunod na drug po.
Thank you so much, Miss
Ayun
Lagindin.
po.
Those explanation really impressed me. I did not expect for some who have those explanation, because seemingly as for the Miss Francine, she considered the 50%, but the right time and frequency really mattered din pala, as according to Miss Laginlin, because I even emphasize, tama Miss Laginlin, emphasize of administering the drug on the right time, because basically it is dependent on the absorption, wherein it will affect the next administration if it will cause a lapse or a gap with the administration and may not reach the bioavailability. So yung bioavailability, we're gearing towards 100%. So kung sa 50% pa lang naglapse na yung next supposedly the administration, so that will really affect na yung other concept. It will affect really the onset, it will affect again the duration of action, but let's see and reveal the answer. So the answer is half-life. Okay? So it's good that you have tried your responses, but still don't be disappointed if you did not get the correct answer, because this is a learning learning session. All of us will really learn from our students, even from our peers, and to yours truly. Okay, next po. Next question. Next question is, the nurse is aware that that a manifestation has been observed at the maximum blood concentration. So, is it the onset? Is it referring to peak concentration level? Is it referring to route of administration? Or is it referring to half-life? So, you may start posting your answer. So, always take into consideration that when you check and when you read questions or situations rather, it may not be a question but a situation, you may consider the terms that will really guide you to have the correct answer. So continue to post your responses. So the nurse is aware that the manifestation has been observed at the maximum blood concentration level. So what are those manifestation? What are those manifestations that we're talking about? So probably it could be the side effect. Yan. There could be a diagnostic test that it really reached its blood concentration level. So let's see. So continue to respond. So we are still waiting for the others. We're still waiting for the others to continue do their posting of responses. Yeah. Okay, continue. Okay, good. Okay, good. Okay, so I think we have already maximized. Yeah, okay. Some may have questions probably, so we will explain later. So probably I may ask students for your answer. May I call on Charmy? Charmy, may I ask your
Hello.
answer?
Sir, malinaw po ba audio ko?
Yes.
Yung sagot ko po is letter B po, pero di po ako sure. Pero pagkakatanda ko po kasi, sa onset po, parang yun po yung area kung saan po yung drug mag-absorb po.
Yeah.
Tapos sa route of administration naman po, mali po pala. Onset po pala yung time interval, tapos yung route of administration, yung area po.
Yung area, okay, correct.
So yung B
so
po
B
yung
is your
pinakamalapit.
answer.
Opo.
Okay. So good analysis. How about, may I ask, how about Angel? How about Angel? Angel? Okay. So probably may ask yan. Karil Legaspi. Karil Legaspi.
Yes po. Ang sagot ko po, sir, is letter B po.
Yeah.
Peak concentration level po. Ano
Opo.
po, na-discuss po siya during yung meron pong time, yung graph po.
Yeah.
Ano po, kung tawagin po siya isang Cmax po or yung maximum concentration po, wherein po yung pinaka-drugs po natin is naka-reach na po siya sa plasma po natin. Kaya po,
Aha.
yung term po na nagbigay po sa akin ng clue is yung ano po, maximum blood concentration po, wherein yun nga po yung Cmax level po. Yun lang po
Yeah.
sir.
Okay, so probably you derive from the explanation that is referring to the video that we have shown before on the maximum concentration level and the time, its relationship, di ba? So thank you very much. So let's reveal. Let us reveal your response, the answer rather. The answer is letter B. Thank you very much for the participation. We have the peak concentration level. Okay? So why peak concentration level? We consider peak concentration level because of the this will consider, okay? This will consider on the perspective that the concentration that we're talking about will always be associated with the what we call plasma. Okay, it's the blood. So once it reach the plasma, as what we have discussed before, yung peak concentration level would reach the maximum blood kung if it is given intravenous kasi immediately direct to the blood. So mag-reach na agad siya sa plasma. Unlike for the oral, unlike for the intramuscular, it will not directly reach pa the plasma because it will pass through different layers pa of tissues. So that's it. So pag sinabi natin route of administration, that will consider the area as mentioned, that is correct. The area wherein it will identify yung difference din ng bioavailability kasi 'di ba magre-reach ng bioavailability, connected siya pag nag-reach agad siya sa peak concentration level, which kung ang route of administration is merely considering po on the area wherein far pa yung pag-reach niya sa concentration. Example, as what we have mentioned, the oral medication will pass through the GU-tip. You can still remember the audiovisual presentation that we have presented. It will pass through the first pass, the liver, then pass through the vein, sa venous, goes to the heart, and goes to the aorta until it proceeds to the systemic circulation. So once it reaches the systemic circulation and reaches the plasma, that is the maximum blood concentration level. Okay, thank you so much. Next, how about next question? The nurse considers the time interval when drug is administered until therapeutic effect begins. We have bioavailability. We have peak concentration level. We have onset of action. And we have the first pass effect. So you may post your responses. You may post your responses in the chat box. Continue to post your responses. Okay? Continue to post. Continue to post your answers. Okay. So we are now 11. We are now 11. Okay. Okay, now. So, okay. So I think just continue your responses. Continue your responses. So I'm seeing different answers for some. Okay, let's see. Let's see. The nurse consider, we are talking about time interval ha. If we are talking about the time interval, we're talking about length of time. Length of time. So yung length of time, the two terms that we have discussed a while ago is the length of time that we're talking about therapeutic effect begins. And the other one is yung period, the length of interval of the whole period wherein the therapeutic effect has been processed. So iba iba yung time, yung length of time that we're considering the whole process of therapeutic effect, and we have the time interval that we're talking about at the beginning of the therapeutic effect. Yung beginning of therapeutic effect is referring to when the drug reach the plasma concentration. So, di ba, dun sa discussion natin of the pharmacokinetics, when it's reached the plasma, dun papunta na siya dun sa process of distribution when it will be proceeding to the different compartments. So, pag umabot na sa different compartments, nag-proceed na ngayon yan, napunta na doon sa mga indicated organs and systems, yun na, makomplete na mismo yung therapeutic or desired effect of the drug. So on that note, yun yung buong interval. But if we're talking about when the blood, when the drug reaches the plasma concentration, yun yung start. So that's the difference. Those are the difference. So let's see. So I have already give you a hint of what is the correct answer, but I will now reveal the answer. So the answer is onset of action. So why onset of action? Because from the term itself, onset, okay? The onset is start. Okay, start. So beginning. So yung difference niya with duration of action, yung duration of action is the time or the length of time of the entire, yan yung entire therapeutic effect until from the start until the drug reaches its desired effect. While the onset is the beginning as it starts its therapeutic effect. So yung first pass effect naman, this is usually when the drug usually related to the oral medication, okay, yung mga oral drugs that are being metabolized by our liver. So this usually is applicable for the oral medications that it will really pass and metabolize through the first pass effect. Okay, next is we have, okay, so actually soon I will upload the webinar that I have conducted with the invitation of the South Isabela Medical Center. Yours truly had been the resource speaker on the medication safety. So the webinar that I will upload in your the recorded webinar that I will upload in your in our Central Linopids PAP will really help on the understanding of the medication safety. And since we're talking about medication safety, actually these are the common rights of medication. And this is since our priority is the safety of our patient, these are the common rights that we are following. Actually, we have already 10, we have already 14 rights of medication. So later on, we'll get into those other rights. But for now, we have to consider the trump. This is the common. These are the common and most important among the medication rights. That's why it's been considered as checklist. So we have the right time. So the right time, usually, this is very important. This is very important to consider because I have mentioned unto you yung basic. Balik tayo dun sa concept of onset of action, duration of action, right time and frequency, bioavailability, half-life. Those concepts are very important why we need to really comply with the proper time. Now, when it comes to the right route, it is very important because when we talk about emergency situations, usually those drugs that are being given are those drugs that will act immediately also. So what do we mean by that? So those drugs that will reach accordingly sa bioavailability o yung 100%. So if we define the bioavailability, the drug that will reach immediately the plasma will have also the 100% bioavailability or effect of the drug. So that's why it may depend on the particularly the route of administration. So next is we are talking about amount. So the amount is referring to the dose. The dose will really guide us on, remember when you are computing for the dosage, always have the baseline or rather have the weight of the client. Lalo na if the client will be subject for operation, the anesthesiologist will really need the weight of the client because that will really the weight is really relevant when it comes to the computation of the dosage, because eventually it may cause a problem if we will not have the weight as part of the computation, because overdosage or underdosage of the drug could cause harm to the client. O sir, bakit di ba overdosage lang po ang pwedeng mag-cause ng harm sa client? Also with the underdosage, because when the client will not receive the appropriate amount or the correct amount of the specific drug, then it will cause the patient of high risk for either infection, high risk for damage of tissues. So those are the basic considerations. Why do we need to compute for the right dose? Lalo na for the pediatric dose, we really need to have the weight for the computation. And the computations, the calculations of dosage will be part of the skills laboratory. So the more on the computations and the calculations of dosage will be introduced to you in the skills laboratory. Moreover, if you will have already your clinical, that will have a more reinforcement of what you have learned from the lecture and the skills laboratory. Next is the right medication. Obviously, when it comes to the right medication, it is very important to consider that we need to know the classification of the drug. Why? Kasi there are some drugs that could look alike. Kasi if we will just depend on the if we will just depend on the physical features of the tablet, all they may look alike. There are some drugs also that may sound alike. So that's why it's very risky to really be involved when it comes to verbal orders. If the doctor just mentioned, oh, these are the drugs that you need to so but the nurse may need to document all of that. So what could be the risk? The risk could be there could be chances that there could be a wrong drug that could be administered. So that's why we really need to verify it with the doctors. So much as the best way is to really have the doctor write it in the doctor's order sheet. The best, that could be the most safest way for us to validate clearly and to identify the right medication. Moreover, the number one that we really need to consider is the patient. Okay, there must be two identifiers for you to really validate and verify the right patient. It is not just only considering the bed tag, the patient's tag. The best is to really ask the patient's name. Okay, but if the patient may have a problem with the consciousness, then you must also take into consideration the other identifiers, and that identifiers could be the patient's tag. Okay, so that is very important. Why do we need to know these rights of medication? Actually, it expanded, as what I have mentioned. It really expanded na into the 12 rights of medication. As mentioned nga in the last webinar that we have, it's already it's already 14 rights of medication. But anyway, let us take into consideration if we have the trump that we consider usually the most important. It expanded pa to Dear Patient Red. What does it mean yung Dear Patient Red? And this is more on the what we call 12 rights of medication. So we have the right documentation. Okay, if we talk about the right documentation, this is referring to nursing process. Okay, when you are about to administer any drug, vital signs are very important, and this will really protect the patients when it comes to adverse reactions of the drug. And when you record the vital signs, and it will also record and document the drug that you have given, this will also serve as the reference that you have the safe medication administration. And in the proper documentation, we have the narrative report of the nurse, which is what we call charting. The nurse will identify the vital signs, and no adverse reactions had been observed, and the patient experiences side effect, but managed and assisted the client. So those proper documentations are very important whenever, if for example the client experiences a complication, so we can justify that it is not related to the drugs that we have administered. It's probably with the health condition, directly with the health condition of the client per se. Next, the right evaluation. When it comes to the right evaluation, it is very important to consider that other than the vital signs as our reference, that we are giving, or we are doing the safe medication administration, the right evaluation that we're talking about is if the patient do not experience the adverse reactions. Moreover, did not lead to toxic effect of the drug. So, because it is very important that when we use the principle of the nursing process, and documentation is really a part of it. We really need to consider the subjective data and the objective data. It does matter po ba when it comes to the evaluation? Yes, because if what could be a successful medication administration, if the patient did not experience any adverse reactions of the drug. So ibig sabihin, during the time that we have discussed, sir, what could be the study ba of the adverse reaction of the drug? So ano yon? If you can still remember, that is pharmacovigilance. Okay? From the term itself, vigilant, pabantayan ninyo. So pharmacovigilance, these are the area wherein it consider the study of adverse reactions. So why it is important to consider it in the right evaluation? It is simply because that whenever the client experiences adverse reaction unexpectedly, so ibig sabihin, if for example the patient experiences the allergic reaction or hypersensitivity reaction, so the nurse must also do the documentation. And if the patient experiences the adverse reaction, then you must document it, because probably if the patient that's why it's very important po that for example, if we will be administering, kasi mabilis nga yung effect ng drug if it is given intravenous, most or not all, most of the drug are being skin test so that to assess hypersensitivity reaction, because if the patient experiences hypersensitivity reaction, it will take risk with the safety of the patient. Thus kasi pag nag-continue ang hypersensitivity reaction, magli-lead na yan into shock. Ano yung shock? Kasi ang hypersensitivity reaction pwedeng mag-cause yan ng constriction of airway passages. So the patient will experience difficulty of breathing, and soon, if the patient will experience continuous deprivation of oxygen, then pwedeng mag-respiratory arrest ang client. So number 3, right assessment. Right assessment is very important because administration of medication will basically consider assessment at the start, before the administration. Continuous assessment must be done during the administration of the drug or after the administration of the drug, because as what we have mentioned, if the client took it orally, so balik tayo dun sa time at saka effect of the drug. Sa oral, di ba, 90 minutes. So yung 90 minutes na yon will consider 1.5 hour. So pag nag-consider sila ng 1.5 hour, then this may consider pa yung matagal na observation sa client. So that's why we need to consider the monitoring if there will be adverse reaction. So that's part of the right assessment. And if ever there will be adverse reaction, lalo na if it is intravenous, continuous flow po yan, yung tinatawag nating piggyback or side drip. then you must withhold the drug. Kasi there are drugs that are being given continuously. So it will be the initiative of the nurse to decide yung clinical decision to save the patient from a complication. Number 4 is the right reason. Probably patients will really ask you, will definitely ask you for first time that the patient will receive the drug. They deserve to know the reason why the drug is being given. As what I've told you, it is not enough that you will say to your patient that the drug is being given because it is prescribed by the doctor. Another, it is good for your health. The drug is given to you because it is based from the literature of the diagnosis of the client. This will not really satisfy the client's confidence of why you will give the drug. It is very important to consider that on a layman's term, on a layman's explanation, the client will understand why the drug is being given to him or her. So number 5, we have the right patient. Is very important. As what I had mentioned, this is the first. When it comes to the rights of medication, you need to consider 2 identifiers so that to facilitate the proper identity of the client. 6, the right time and frequency. As what I have mentioned, I know that you have been oriented on the frequency. If I may ask, if you can still remember, or if this was introduced during your fundamentals of nursing, do you know what BID means? You can type in our chat box. Do you know what BID means? BID. Anyone? Anyone in the class? Do you know what BID means? BID. Okay. Okay. So we are ayan. Okay. So I have received answers. You're correct. It's 2 times a day. Why BID is 2 times a day? Why the BID is 2 times a day? Kasi this is a Latin term. Kaya pag ano yan, buy in die. Buy in die, it means 2 times a day. Buy is 2, di ba? So 2 times a day. So pag TID, it's try in die. Die, D-A-I. Die. So ibig sabihin is 3 times a day. QID. QID is 4 times a day. So bakit naman siya naging QID? So we have the what we call quasi-in-die. So that is 4 times a day. So PO, it means that that's not purchase order. That's per orem. Okay. Then we have also some of the medication abbreviations that is very important in relation to the right time and frequency. Okay. So there are some questions that may arise also that why there are drugs that are being given at night. Yan, it's good at night. Usually those drugs that will control cholesterol are being given at night simply because usually the patient the patient will have slow metabolic activity at night. So yan yung peak na ang synthesis of cholesterol ay slowly metabolized. That's why yung cholesterol itself is the one that could risk the patient to cause obstruction of the blood vessel. Kaya usually ang mga anti-hypercholesterolemia are being given at night so that to control. Kaya for those who may have history of hypertension, for those who may have history of heart attack, I think the diet are being advised at night na moderate na lang kasi nga of the slow metabolic response of the body. So that's one explanation that your patient may benefit from it, yung awareness, and when it comes to the in connection to the response of the body. Yung right to refuse, okay, there are some situations that the client refuse drug because they sometimes experience discomfort with side effect, and they do not want anymore to continue. Example, for those who are taking anti-tuberculosis drug or anti-TB drug, most of the anti-TB drug, example, rifampicin. Rifampicin is an anti-TB drug which is usually taken on an empty stomach. So, the client usually, sabi naman natin, di ba, sa oral route of administration, high risk for gastric irritation. Ang purpose naman why it is given on an empty stomach, it's for the effective absorption. So lalo na in the morning. So kasi why in the morning at empty stomach? Kasi usually in the morning, for those who may have tuberculosis, ito yung peak ng production of the secretions sa lungs for those who may have TB. So it so happened dun sa patient with TB, yung secretions are infected. Okay? So yun yung peak ng production at peak din ng pag-produce na pag-increase ng microorganism or growth of microorganism. So that's why the empty stomach itself may promote an effective absorption so that to facilitate the effective also inhibition of the growth of the microorganism and to facilitate also to control yung copious secretions. So if the client already will refuse because of the discomfort because she's experiencing let us still convince the client of the possible disadvantage or rather the disadvantages if she or he will discontinue the drug, because usually ang mga anti-TB drugs are being taken for 6 months. So if she will discontinue, it may not reach yung purpose, it may not consider its purpose of controlling the microorganism that really affects the lungs. So kung mag-refuse siya, the client may sign that she refused, but moreover, as advocates of patients' health, we must take into consideration that we must explain further. Baka if the patient may just need further explanation of the drug. So there are some situations like that because if you have already established a trusting relationship with the client, then they really have the confidence to believe on what you are saying and what you will instruct to them. So the next is we have the right route or route. It is very important because situations that we really need to consider po yung administration. Example, if the client will receive a localized anesthesia, if we say localized anesthesia, it will be given on a specific area. Kaya pag nakakadinig kayo ng localized anesthesia, it will just only have anesthetic effect doon sa area. For example, I will have a surgery on my right arm. So it may need the administration of the localized anesthesia. So it will only cause yung localized area na anesthetic effect dito lang. But it will not cause any anesthetic effect to other parts of the body, which is different if the drug will be given on a spinal anesthesia. Spinal anesthesia are being given sa mga those who will for those na gusto yung painless delivery sa mga normal spontaneous vaginal delivery, kasi ang effect ng spinal anesthesia from the term itself spinal, it will be administered in the spinal area. So directly it will administer to the spinal it will pass through the spinal fluid. So ang effect ng anesthesia niyan is on the area of the abdominal back, bababa. So these are the usual anesthesia that are being given for cesarean section, for painless delivery. So yon doon nagkoko. So half of the body, specifically the low extremity. Ano naman yung general anesthesia? So from the term itself, general anesthesia, these are usually given by inhalation. So kung by inhalation yan, the general anesthesia, the whole body will have the anesthetic effect. So you can now see the difference from local anesthesia, spinal anesthesia, and general anesthesia. So yung effect mismo will identify specifically on what could be the role of the nurse when it comes to the patient safety, when it comes to the responsibilities on how to prevent from any complications brought about by the administration of anesthesia. So these are the common example. So next po is we have the right expiration date. Okay, these are some mentality from us Filipinos na okay, if it is expired today as perceived, pwede pa yan for the next month. Pwede pa, meron pa yan, meron pa yang life span pa na pwede pang it could be administered for 2 months. Class. expiration date are being considered so that for us to be guided if it is not anymore, if it's not anymore will cause yung patent effect. Okay? Pag sinabi nating patent, yung effect. So kung for example, antibiotic, if it is expired today, then do not administer, do not take risk because it could be useless. The expiration will give us the idea that yung potency of the drug is not anymore intact. That once if it is given to the client, then there will be no effect. Or on the other hand, an expired drug may cause a toxic effect to the client. So both will still cause an injury or possible injury, and it will be our responsibility. So the number 10 is referring to the right education. When it comes to the right education, we're talking about on how we will facilitate the awareness, the confidence of the client that they are receiving the right drug, and they will facilitate it kasi the right education also, you are also promoting independence for the client, that this when the patient experience it, these are alarming alarming signs, red flag ito, I need to report it to the nurse because this is not a side effect anymore. This is an adverse reactions. Okay? So the nurse will also continue to have the explanation whenever, for example, the client will experience the signs of the toxic effect. That is very alarming because it's already life threatening. So the nurse will, if the client will verbalize it, then the nurse will prepare already the antidote, and the antidote will counteract the toxic effect. So that is basically the benefit of why we give the right education. The right drug, obviously. So if we are not giving the right drug, it may not support it may not support yung indication. So that's why when you check the drug, the indication itself, okay? The indication is very important. That's why for those drugs and medications that you have encountered, aware na kayo of how of the indication of this drug and what is the effect of this drug. So even in a simple, even the over-the-counter drugs, we have mentioned about the paracetamol. Paracetamol could be used as antipyretic. Pyresis is referring to the temperature. So we are talking about antipyretic. Pyresis is talking about the fever. So kung febrile conditions ito, so it may cause the management of the fever. And we all know that ang paracetamol then can be used also for pain. So pain reliever din ito. So yun nga lang, the problem with the paracetamol, if it is abused, it will damage your liver. So that is one that could be part of the Kaya that's why we must not depend on the we must not depend specifically on the what you call this, on the pharmacological treatment. We must also take into consideration to manage it by the non-pharmacological measure. So the 12 is, this is an important, the right dose, the dosage D over S, the dosage over stock times quantity. So this is the basic formula of computing the dose. And as what I have reiterated a while ago, that the weight of the client is very important and will be used for the computation of the right dose for the client, because it may vary po it may vary by age, it may vary by weight, so that this will also this will also take into consideration the appropriateness, the safest dose that the client deserve to have. So it may vary. We may have a general dose for adults and general dose for the pediatric clients. Di ba may mga age pa yan, range. But for those who will be receiving medications that will really need computation of dosage, it is very important because it's for purpose of safety. Now, we have the 12 rights of medication. Do you have any questions on the rights of medication or anything that you wish to share? If you don't have any question, can I see thumbs up from our students? If you don't have any question, because since it's already 6:44, it is scheduled already for the health break. So we may have primarily a health break for 15 minutes since it's already 6:45, and we will resume at 7 o'clock. So have your extremity stretched, do hydration, drink a lot of fluids before we have the resumption of our classes at 7 o'clock. Take your time. So students, let us continue. I know it's a heavy rain we are experiencing, so we just do have only 30 minutes to have our synchronous discussion, because I know some of you are really having concerns with connectivity, but I really appreciate that you're still with me in our learning session. Now, this is what I'm talking about on how you will be guided. These are some suffixes. Actually, the suffixes are the ones that will really guide you when it comes to medication. Always take into consideration the generic. Okay, we may not focus on the brand names, because as what I have mentioned and reiterated before, the brand names are used to identify the pharmaceutical company as the manufacturer of the drug. But the generic itself is the one that will guide us on the functional classification of the drug. Okay? Now, let's start. If the drug is ending in cane, okay, cane, these are local anesthetics. And one of the examples that I mentioned is that of the effect of the local anesthesia is it will just have anesthetic effect on a specific area. Okay? So just like, for example, if you will have tooth extraction, you will receive local anesthesia. So it means that the localized area will be anesthetized only. So for example, if you will have removal of breast mass. For the removal of the breast mass, it may not need spinal anesthesia, it may not need general anesthesia. So localized anesthesia are being given to the specific site where the mass will be removed. So those are the indications of the local anesthetics. So anything that ends in cane, such as lidocaine, bupivacaine, lontocaine. Kaya if you will notice, these are generic names of local anesthetics. But what is common with the suffixes? Cane. Clear? So another thing that you must take note is that of, if lidocaine, I'm referring to lidocaine. If lidocaine is given intramuscularly, it will have anesthetic effect. But are there any instances that lidocaine are being given intravenously? The answer is yes. Because lidocaine, once given intravenously, obviously it will not have its effect as local anesthetic, but it will correct the cardiac rhythm. So anti-arrhythmic drug ito. So that's why it's very important. If it is given intravenous, it may have a different indication. If it is given intramuscularly, it may have a different effect. So what I'm talking about here is that of lidocaine, bupivacaine, lontocaine, canes are local anesthetics. Next, drugs ending in done. Okay, what are done? These are opioid analgesics. So what do we mean by opioid analgesics? There are some drugs, right, the pain medications that causes dizziness, right? But there are some pain medications or pain relievers that do not cause dizziness. Example, when you take ibuprofen, you will not experience any dizziness. When you are taking mefenamic acid, you are not experience any dizziness. So these are the over-the-counter drugs that you have taken already, and there are no dizziness. But anything, any pain reliever or analgesic, should we say, that may cause dizziness, it means that the pain reliever is direct. It will have a direct effect to the pain center of the brain. So on that note, kaya siya tinawag na opioid. Kasi di ba opium? Yung opioid itself, etong mga opioid analgesic na ito are regulated. What do you mean by regulated? They can't be purchased over the counter. It may need the prescription. Other than that, actually, this opioid analgesics, it can be it can be abused. Pag more that it could be abused, it could lead to addiction. So that's why it is regulated. And remember, take note of this, opioid analgesics can be purchased with a prescription and at the same time with S2 license. Okay? S2 license. These are license being given to a doctor who will be allowed to have prescription of drugs that are regulated. Regulated meaning it can't be purchased without the S2 license. So ito yung mga drugs that are most, it may lead to danger if it will not be prescribed by a licensed physician. So opioid analgesics are usually, kaya to tinawag na narcotic analgesic. Opioid are also called as narcotic analgesic kasi if this will cause abuse, pwedeng mag-suppress yan ng cerebral function. And it may cause the patient, other than dizziness, become unconscious because it will suppress the medulla oblongata. So and the pain center as well. So yun yung kasi pag nagbigay ka ng pain reliever, kinokontrol mo kasi yung impulse transmission. And that may affect also the consciousness and the cerebral function. So be very careful when you are giving narcotic analgesics. So these are drugs ending in done. This is hydrocodone, oxycodone, methadone. Regardless of the generic, gawin pa natin yang methadone, methicodone. So any that will be released in the market that ends with the suffix of done in the generic, these are opioid analgesics. Next, we may have drugs ending in mycin, MYCIN or MICIN. These are what we call antibiotics or antibacterial. Okay. Those drugs that ends in mycin, such as erythromycin, clarithromycin, azithromycin. Remember, if you are taking this type of antibiotics, usually erythromycins are given ito sa mga sa mga may mga lung infection. Azithromycin, very particular ito during the time of the COVID-19 infection. These are usually prescribed as antibiotic during the time of the peak of the COVID-19. Sir, question, di ba ang COVID-19 is viral? So, eventually, may mga opportunistic diseases din na mga bacterial in nature na pwedeng mag-lead sa pneumonia. So if you notice, yung COVID-19, ang complication niyan pneumonia. So that's why there are antibiotics that are also being given to control naman yung complications of pneumonia. Kasi nga yung virus itself may cause the production of secretions and that secretions could be infected. So magkukos naman siya ng bacterial infection. So always remember when you are taking these antibiotics, yung mga mycin, always take it on full stomach because these are gastric irritating drugs or antibiotics. Another is, if we say oxacin. Oxacin are broad spectrum antibiotics. Let's go back to your microbiology. In your microbiology, we have the culture and sensitivity test. We have gram-negative bacteria and gram-positive bacteria. So, if we say broad spectrum antibiotics, this will combat both gram-negative and both gram-positive. So, it kaya broad spectrum, high level of the high spectrum ng level of antibiotics because it will inhibit the synthesis of both the gram-positive and the gram-negative. So, usually, these are drugs usually prescribed or indicated sa mga severe infections, sepsis. So, pag sinabi natin sepsis, these are severe infections. So, even during the time of COVID-19, isa ito sa mga binigay din other than azithromycin. Pagka mga critical level, usually they are giving this oxacin. Usually mga levofloxacin. So oxacin, levofloxacin, ciprofloxacin, norfloxacin. So oxacins are broad spectrum antibiotics. Next po, beer. Any drug that ends in beer are antiviral. Okay? So, antivirals are usually the most common antiviral here is the acyclovir. Acyclovir are also being given sa chickenpox. But di ba remember during the time na nagdi-discover ang mga pharmaceutical companies sa mga antivirals. So, if I'm not mistaken, we'll have monoclovir. So it ends pa rin sa beer. So yun yung suffix ng beer is the one, not beer ha. Beer is the one that will really guide you po on the perspective of these are antiviral. Abacavir, acyclovir, adepovir, ciprovir, norprovir. So in any case that it will be out of the market yung generic and ends in beer, then these are antiviral. Okay, so I have here in the chat box a question. So it is used po para sa mga non-diagnosed or hindi pa nabibigyan ng okay. Diagnose yung broad spectrum according sa yes, opo. Ganito po 'yon. Thank you very much for that information, Karil. Yung mga broad spectrum antibiotics, that is a correct statement and correct input by your professor in microbiology. Pag wala pa talaga yung resulta or hindi pa distinct talaga yung definitive yan. Pag nasa working diagnosis pa lang, we are discovering pa lang what caused really the infection, then the client will really receive the broad spectrum antibiotics. Pag lumabas na yung result ng culture sensitivity test, then that's the time that will lead to the specific antibiotic that will combat the specific type of antibiotic. So thank you very much for sharing, Ms. Legaspi. So that is correct. Broad spectrum antibiotics are being given if there's no still yet a distinct identified microorganism. So on that note, we have other drugs also that refers to the what we call DIN. Ayan, DIN, not DIN. DIN or DIN. Sige. Yung mga tinatawag natin na mga anti-ulcer agents. Okay. So I will simply explain this. So, ang DIN, ranitidine, famotidine, cimetidine. So all drugs ending in DIN. Meron pa yan ranitidine, famotidine, cimetidine. If I'm not mistaken, I have mentioned about cimetidine, that's for pediatric. So drugs that are given on this are what we call anti-ulcer agents. Pero meron tayong mga drugs before na pag for example, you are experiencing gastric upset or hyperacidity, 'di ba? Nakakarinig kayo Gaviscon, yung sa Gaviscon kasi pag nagre-reflux yung acid But for purposes of hyperacidity, do syempre, pag hyperacidity, if we say hyperacidity, mataas yung acid level, what counteracts the acid? If you can still remember in your biochemistry, what counteracts the effect of the acid? Anyone can post in the chat box. What counteracts acid? Letter A also or letter B? What counteracts the action of acid? Anyone from our registered nurses? Okay, I received one response. Yes. Okay, thank you so much. Sige, I'll try pa the other I think yes, okay. So I got two correct answers. What counteract the action of acid? I have two correct answers already. I'm receiving two private message which considered as correct. How about for the rest? Okay, what counteract the action of the acid? Okay, silence. Yeah, okay, it's antacid. That's correct. That's correct. Okay, that's correct. Okay. So you are correct. The one that counteracts the hyperacidity are antacids. And usually, antacids from term itself, antacids are base. Alkaline, di ba? Alkaline. Okay, that counteracts also the acid. And antacid is the drug that counteracts the action of the acid. Those examples po natin ng mga alkaline-based drug that counteracts the hyperacidity, ang common natin dyan yung aluminum at saka yung magnesium. Okay? So, class, when you are giving aluminum magnesium hydroxide, if you will encounter maalox or maelox, sabi nila, maalox, aluminum magnesium hydroxide, these are base that controls hyperacidity. So it could be a tablet in form, there is a liquid in form. So yun nga lang, you need to take into consideration when you are taking aluminum magnesium hydroxide, if the client, yan, isa sa mga side effect, take note of this if the side effect, if the side effect, I'm sorry, if the present condition of the client is constipation, don't give a drug, an antacid that has aluminum. Why? Because the side effect of aluminum is constipation. So pwedeng mag-cause ng aggravation of constipation. On the other hand, if the client is experiencing diarrhea and may need the administration of an antacid, please do not give antacid with magnesium because the side effect of magnesium is diarrhea. So it will further cause the problem with dehydration due to frequent pass of the stool. So remember that So there are some situations that the hyperacidity cannot anymore be managed with antacids. So papasok tayo dito sa anti-ulcer agents or what we call histamine 2 blockers. Class, we have histamine 2. Ang histamine 2 po class ay basically mag-consider po sa neurotransmitter po ito. Pag sinabi na if we say neurotransmitter, the histamine 2 is the one that transmit impulse, signal to the gastric cells. So, yung signal that is being transmitted by the histamine 2 is related to the production of hydrochloric acid. So, if we block the histamine 2, magti-trigger ba yan sa pag-stimulate ng hydrochloric acid? Hindi na. Kasi pag binlock mo si histamine 2, mabablock din yung signal that will continuously produce the hydrochloric acid. So, ito po yung mga histamine 2 blockers. So, anti-ulcerant. Okay? Yung histamine 2 is a neurotransmitter that transmit impulses to stimulate hydrochloric acid. If it will be blocked, kaya pag nakakadinig po kayo ng blocker, then it will inhibit the production of histamine 2. It will inhibit also continuous production of hydrochloric acid. Okay, next. So, sir, how about ako? I even experience. I will tell you po my experience because I undergone the operation of cystectomy. I do not have any more gallbladder. So, during the time that I experienced yung pain of the cholelithiasis, yung presence of stone in the gallbladder, it's really very painful. And usually, one of the discomforts that I usually experience during that time is really gastric irritation. It's really a very painful gastric irritation. And it can't be managed only by antacid, by anti-ulcer agents. Usually, ang highest level na that usually can be managed during that time is yung tinatawag nating proton pump inhibitors. So, try to search what are these proton pump inhibitors. Those proton pump inhibitors po, kung si histamine 2, ang control niya ay impulse transmission, si proton pump mismo sa cell na. Sa cell that really consider kung mag-stimulate ng hydrochloric acid. So, kung si histamine 2, it's only an impulse, pero yung cell mismo na ang makokontrol ng proton pump, doon na hindi magkukos ng stimulation of the hydrochloric acid. So, proton pump inhibitor. So, ini-inhibit yung proton pump, proton terminal pump. Ini-inhibit yung proton pump to stimulate production of hydrochloric acid. These are drugs, take note of this, these are drugs that ends in prazole. Prazole. Omeprazole, lansoprazole, esomeprazole. These are already yung hindi na nato-tolerate yung antacid. Next, anti-ulcerant or histamine 2 blockers, Tidin or DIN. If it cannot anymore tolerate, then we'll proceed to the proton pump, which are prazole. So these are the drugs na we may not memorize all of these drugs, but if we are aware of the suffixes, it will really guide you po on how you will identify yung specific drugs. Next po, ito po sa drugs po such as LAM-PAM, yan, anti-anxiety. Those that ends in LAM and PAM, such as lorazepam, diazepam, clonazepam. One that is very familiar kayo dito is yung diazepam. The brand name of diazepam is Valium. Have you heard that? Yung Valium kasi, in short, ito yung pampakalma. Kaya that's why if there are situations na uncontrolled yung behavior, naghihysteria yung patient, usually these are the ones that are being given to control hysteria, to control yung talagang untoward behaviors, uncontrolled behaviors. Pampakalma po to, anti-anxiety agents. Pero remember class that these are also regulated drugs. Kasi alam po natin na any drug that is usually direct ang effect sa brain center, ito po yung may risk na pwede pong mag-cause ng possible or direct complication. Kaya be very careful in administering these drugs. Kasi na-abuse nga to. Ito yung mga common na na-abuse na drug. So, can you imagine kung ang patient mo, buntis, nag-take ng diazepam, it will cause also an effect to the fetus. Ganun siya kalakas. Kaya these drugs are not being given usually to patients kasi nga yung degree of yung risk may affect the fetus. But for some situations kasi na may mga instances talaga na yung those who are on a process of spontaneous delivery, tapos at the same time yung behavioral and at the same time yung anxiety is getting high, nagbibigay sila rin ng diazepam. But merely we really need not to give a high dose kasi pwedeng mag-cause yan ng respiratory suppression sa baby. Okay? Next, how about NIUM? That's NIUM, N-I-U-M. Ang NIUM po ay neuromuscular blockers. Ano po yung neuromuscular blockers? So, ibig sabihin, neuro, nerve, ayan, nervous, muscular, muscle. So, yung neuromuscular po, neuromuscular blockers, kaya sa NIUM, ito po yung nagko-control. Di ba may mga instances na may mga muscle contractions na uncontrollable. May mga movements po tayo. Ano po yung mga ito? Sa may mga situations ng Parkinson's disease. Sa Parkinson's disease, medyo these are uncontrolled muscular movements. So usually ang mga binibigay diyan mga neuromuscular blockers. So lahat ng drugs ending in NIUM. Okay? So next po, hoping you can still follow. We are about to end because this will be the last slide. Pero these are full of information. I hope you can still connect with me, ha? Okay, next po. The next drug that I will be discussing is statin. Okay, statin. Sa mga drugs na ito, statins are anti-hyperlipidemics. From the term itself, lipid. Lipid is referring to cholesterol. So, alam niyo po that the cholesterol is insoluble sa plasma. So, paano yan nagtatravel? Buong buo, nagtatravel yan sa mismong nagtatravel yan sa plasma. meron tayong tinatawag na LDL at saka HDL. Yung LDL, ito po yung low density lipoprotein. Ito po yung mababaw lang na pwedeng dumikit sa endothelial lining ng blood vessels. Yung low density lipoprotein, yan po yung cholesterol. Kaya siya lipid. Yung cholesterol, yung lipid ay naka-encapsulate dyan, lipoprotein. So kung low density lipoprotein yan, it means that this is the one that could risk yung attachment sa blood vessel. Ito yung nagko-cause ng obstruction. Yung high density lipoprotein, yan yung mabilis ang obviously high density. Yan yung hindi nagdi-dislodge sa blood vessel. Ngayon, we have mentioned in the previous discussion na pagka the older yung age, the greater chances na mababa ang metabolic activity. So hindi nakokontrol yung cholesterol. So lahat ng mga statins po, such as anti-hyperlipidemics, are usually given at night. Kasi ang metabolic activity po ay mabagal at night. So that's why statin, simvastatin. I know So please try to ask, most common mga binibigay sa mga matataas ang cholesterol. Please ask your parents or any members of the family who are taking this. Simvastatin, rosuvastatin, fluvastatin. So drugs ending in statin are anti-hyperlipidemics, and usually these are taken once a day at night before sleep. Okay? Next po, let us now proceed to patients with hyperglycemia. Okay. Ano naman po pag hyper? Hyper, obviously, it's high. Glycemia, sugar. Imia, blood. Kaya pag sinabi nating hyperglycemia, high sugar level. High blood sugar level. Now, lahat ng drugs ending in IDE, are oral hypoglycemics. So what do we mean by hypoglycemics? Pag sinabi nating hypoglycemics, this will control or lower blood sugar level. Okay? So example natin, glimepiride, glipizide, gluporide. So lahat ng IDE, ang huli, these are oral hypoglycemics. So careful din sa pag-administer nito because there are some instances na controlled naman ang blood sugar. Kaya it's very important if you will be diagnosed with with diabetes na uncontrolled ang blood sugar level, tsaka lang po binibigyan ng mga oral hypoglycemics. Kaya it will be traced kung kayo po talaga ay may diabetes through a series of diagnostic tests. Next po is we have the what we call proceed tayo in zone. Ayan. So drugs ending in zone is steroids. Familiar kayo sa steroids? I know that you have heard about. Sir, paano po kung ang steroids ay given intramuscular? And if steroids are given how about if it is given intravenously? Okay, if the drug is being given intravenously, ang effect po, ang steroids po class, ang effect nito ay anti-inflammatory. Okay? So lahat ng mga, usually almost lahat ng mga diagnosis na madidinig nyo na may itis meaning pericarditis, endocarditis, bronchitis, lahat ng may itis, this is an indication of inflammation. And usually sa mga severe inflammatory conditions, ang mga binibigay ay steroids. Sir, we have heard about if the steroids are given intramuscularly. Okay. Ang steroids are being given intramuscularly. Sir, di ba nakakapagpalaki ng muscle yon? Actually, class, ang steroids po are not supposedly given intramuscularly. That may add, alam niyo po, that will add to the muscle mass. Pero there could be a risk then. Kasi pag ang steroids continuously being given to the muscle, pwede rin yan mag-lead into muscle tissue death. Kaya don't ever have risk because it is not the indication of giving steroids. Anti-inflammatory nga yan eh. So it could be given, there is a preparation for intramuscular kung ito po ay in relation to diagnosis. But if it is related to increase the muscle mass, opo, don't take risk. Don't ever take risk because it will possibly, instead of therapeutic effect, pwedeng mag-lead yan sa adverse reactions. So, an example natin dyan sa mga zone, dexamethasone, hydrocortisone, betamethasone. Zone. So, S-O-N-E. Okay? So, we are leading to the last suffixes. Yung sa mga suffixes natin na ends naman with "zide". Iba yung "ide" ha. Yung "zide" at saka "mide". Sa "zide" at saka "mide", pag sinabi, if we mention about diuretics, di ba, pag sinabi nating diuretics, this diuresis itself is to facilitate urine. Okay? Urine output, excretion. So anything as for diuretics may cause removal of excess fluid by the excess fluid of the body. So that's why, when is the time, sir, that the patient is really having fluid overload? Pitting edema. Manas is different from maga ha. Ang manas is yung edema niya is caused by accumulation of fluid, not because of the thickening of the tissue or inflammation of the tissue. So, pag ang patient mo meron enlarged heart, pag enlarged ang heart niya, that's an indication of fluid retention. Pag ang lungs niya ay full of fluid, that is fluid retention. So diuretics are being given so that to facilitate the removal of excess fluid sa body. Kaya ito yung mga chlorothiazide, hydrochlorothiazide, methylclothiazide, all with thiazide, at saka yung may mide sa huli, yung diuretics, mide. Ang careful lang po tayo when we are receiving po mga diuretics kasi nga too much fluid will be removed out of the body, pwedeng mag-electrolyte imbalance. Usually, ang usual electrolytes that are affected ay potassium. Kaya careful din po sa pagtitake ng diuretics kasi you need to balance din ito dahil ang risk naman ay biglang bumagsak ang potassium. And remember, ang potassium, malaki ang factor nito sa action ng heart. Kaya careful po pag biglang bumaba ang potassium. So next po, drugs ending in pril. Medyo marami na tayong na-discuss pero we are now on the last portion. Sa pril naman ay ACE inhibitor. What does it mean? Ang ACE inhibitor po ay antihypertensive drug. At ito po yung mga ends in pril. Captopril, isinopril, enalapril. Oops! Walang April. Okay. Patawa ka, sir. Nagugutom na kami. But if we talk about the ACE inhibitor, ang ibig sabihin kasi ng ACE inhibitor, angiotensin converting enzyme. Bakit siya ini-inhibit? Kasi usually po, ang blood pressure natin, ang nagre-regulate po ng blood pressure natin ay directly heart but with the aid of the kidneys. Ngayon, ang problem dito po is that pag tumataas ang blood pressure, 'di ba si adrenaline natin tumataas din para to help the heart pump. Pero habang tumataas yung adrenaline, sumisikip naman yung blood vessel ng kidney. So si kidney naman ang naapektuhan. So para ma-prevent yung problem with the kidney, para maayos din yung blood pressure at maayos din yung problem with the kidneys, ito po yung binibigay to manage blood pressure. Pril. Captopril, isonilopril, enalapril. Lahat ending in pril. These drugs are usually given on an empty stomach para maganda yung absorption. Next, we have drugs ending in pin or dipin. Amil. Meron pa nga yan amil. Pero most ito ay min. Pelodipin, amlodipin, nifedipin. Lahat ng pin or dipin ang huli, calcium channel blockers. These are drugs naman, kaya kailangan i-block si calcium. Example, pag sa blood vessels ng heart, meron diyang nag-cause ng damage. Usually ang calcium ang nag-aid po para mag-dilate yan at mag-contract. But the problem is that dahil pag tumataas lalo ang calcium sa blood vessel, magde-decalcify yan. titigas yung blood vessel. So pag hindi na nagko-contract ang blood vessel, hindi yan nagpo-push ng blood. So ang calcium kailangan i-block para hindi mag-cause ng tinatawag nating sclerosis o yung pagtigas ng blood vessel. So binigyan lang natin tayo ng overview. So last but not the least, I know you have information overload. Olol sounds not pleasant, pero most of the olol, eto are usually binablock naman nito ang beta. O kanina, yung histamine 2 is a transmitter that is used for the stomach, yung impulse. Ang beta naman po ay for the heart. So pagka ang patient ninyo ay nagpapalpitate or too much na yung workload ng heart, kailangan pong i-block si beta para makontrol naman into a normal pacing and rhythm yung heart. At ito po ay propranolol, metoprolol, atenolol. Kaya if you are aware of those clients po natin na may mga goiter, hyperthyroidism. Pag hyperthyroidism sila talaga, pag mataas ang hormone ng thyroid, mataas din yung metabolic activity. So kung mataas yung metabolic activity, mataas din yung neurotransmitter. So pag mataas si beta 1, sige, push siya pag-contract ng heart. Napapagod din ng heart, nag-increase yung workload, nag-increase yung oxygen demand. So to prevent this, olols are being given, beta blockers. So let's have a review. So when we talk about this concerns, these are medication suffixes, common medication suffixes that will help us in having or in understanding pharmacology. So cane, these are local anesthetics. Done, these are opioid or narcotic analgesics. Mycin are antibiotics. Oxacin are broad-spectrum antibiotics. Vir are antivirals. Dine are histamine 2 blockers. LAM and PAM are anti-anxiety. Neom are neurovascular blockers. IDE are for hypoglycemics to stabilize the blood sugar. We have the zidandamide diuretics to remove excess fluid of the body. Pril is for to help regulate blood pressure involving kidney and the heart. And we have the dipine, and the amyl. So verapamil kasi yung amyl. So dipine, we have calcium channel blockers so that to prevent the hardening, the hardening of the blood vessel, and olol to control the heart contraction. So hoping many information has been discussed. So hoping that you will have this review, because I will post an asynchronous session, but not tonight, but I will keep you updated of it. Probably we will continue it by tomorrow, but I will keep you updated if I have already posted about asynchronous activities for our discussion or topic that has been discussed today.